Good morning, doctors, my teammate, and my fellow batchmate. Today, my group will present a topic regarding COVID-19. The slide is prepared by Qing En, Puisa, Xiangquan, Winwin, Jinrong, and Hui Li. Li Ying will be editing the video. Me, Sushan, and Derek will present this topic. So let's get started. So I will be mentioning the epidemiology of COVID-19. The first outbreak of COVID-19 was identified in Wuhan, China in December 2019. World Health Organization declared the outbreak as a public health emergency of international concern on 30 January 2020 and as a pandemic on 11 March 2020. It indicates that the outbreak is getting serious and it may spread to other countries. On 2 June 2020 at 10:06 a.m. Central European Summer Time, which in other words it means 4:06 p.m. in Malaysia, the official reported that around 6 million confirmed cases and 375,656 deaths worldwide. The older people and people with chronic conditions like cardiovascular disease are at a higher risk of getting severe complications if they have COVID-19. United States of America has the most number of confirmed cases, followed by Brazil and Russia. According to the number of deaths in the country, USA still has the most number of deaths, followed by United Kingdom and then Italy. So in general, you can check that America, Russia, Europe, and Middle East that show a greater number of confirmed cases compared to other countries. Coronavirus was first detected in Malaysia on travelers from China on 25 January 2020. In late February 2020, there is a second wave of COVID-19 outbreak in Malaysia that is linked to religious gathering in Sri Badareen. Since then, Malaysia government has announced movement control order in response to this pandemic. Till 2 June 2020, Malaysia has been reported with a total up of 7,877 cases, 6,470 recovered cases, and 115 deaths. Till the date, Kuala Lumpur and Selangor has been reporting high number of cases. So in this map, we can see that Selangor has 1,926 cases and Kuala Lumpur has 2,044 cases, which show up the most number of positive cases in Malaysia. So in general, you can see that the trend of the COVID-19 is keep fluctuating from 15 April to 2 June. During the phase MCO, the number of cases keep fluctuating between 31 and to 110. During fourth phase MCO, it kept increasing. During conditional movement control order, the trend is fluctuating.
Hello everyone, I'm Sushan, and I'm going to walk you through on the properties of the causative agent for COVID-19, how COVID-19 can be transmitted, and the clinical features that actually can be found on a COVID-19 patient. So for your information, the causative agent for the COVID-19 is actually beta coronavirus. The beta coronavirus genera actually descend from the bat gene pool, but there is no actual evidence yet to link with an animal reservoir. And within the beta coronavirus genera, the commonly recognized lineages are type A, B, C, and D. And for the COVID-19 cases, the lineages B includes severe acute respiratory syndrome coronavirus 2. And the severe acute respiratory syndrome coronavirus 2 is a single-stranded RNA virus that causes the COVID-19 pandemic. So, as you can see, there is actually the membrane protein, the nucleoprotein, genomic RNA, hemagglutinin esterase, enveloped small membrane protein, and the spike glycoprotein. And all these coronaviruses contain those several key of proteins, that I mentioned just now. And as you can see on the right hand side, this diagram actually shows the severe acute respiratory syndrome coronavirus 2 under the transmission electron microscope. The COVID-19 virus is generally transmitted between the individuals through respiratory droplets and contact route. So, first and foremost, I'm going to talk more on the transmission through the respiratory droplets. In order for the virus to be spread without being coughed or sneezed in large drops of mucus, it has to be somehow be able to suspend in the air for long enough to infect the passers-by. And the respiratory droplets are droplets with the presence of organisms of size more than 5 micrometer to 10 micrometer, which in this case is actually the presence of the COVID-19 virus. And the droplet transmission occurs when a person is in close contact, which is within 1 meter with someone who has respiratory symptoms such as the coughing or sneezing. Therefore, that person is at risk of having his or her eyes, mouth, or nose exposed to potentially infective respiratory droplets. And the respiratory droplets from the coughs and sneezes of individual actually infected with COVID-19 virus will enter the body of the people around him or her through the mucosa, which are the mouth and nose, or conjunctiva, which are their eyes. So, moving forward to the transmission through physical contact. So the transmission of COVID-19 virus through the physical contact occurs when the viral particles actually emitted from the respiratory tract of an individual infected with COVID-19 virus land on a surface, such as the hands or table, or any surface such as the metals or the plastics. Then another person touches that surface. So this will cause the person who touches those surfaces that have those respiratory droplets, then the COVID-19 virus actually will sneak into the body of the person via the mucous membrane of the nose, mouth, and eyes, thus infecting the person. Moving on to the clinical features of the COVID-19, and the most common symptoms that all of us must know is fever, dry cough, or extreme tiredness or lethargic. The less common symptoms are sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin, or discolorations of fingers or toes. And moving on to the serious symptoms that you can find on the COVID-19 patients is the difficulty in breathing or shortness of breath, chest pain or pressure, and the loss of speech or movement. So on an average, it takes actually 5 to 6 days from when person is infected with the virus for symptoms to show. However, it can actually take up to 14 days. So if you come across to those symptoms, please advise with the doctors at the hospital nearby.
Good morning, doctor. I'm Chu Jie-wei, and I'm going to explain about the lab diagnosis of COVID-19. In the lab diagnosis of COVID-19, there are two kinds of tests, viral test and antibody test. Viral test tells current infection and the antibody test tells previous infection. The antibody test may not be able to show current infection because it may take 1 to 3 weeks after infection to produce antibodies. The protection period of the antibodies and the protection of antibodies from having the infection of virus again is unknown. Regardless the result is positive or negative, it does not confirm whether or not to spread the virus that causes COVID-19. The first test is viral test of COVID-19. In the virus test of COVID-19, the samples are took from respiratory system, such as swabs of the inside of nose, to show current infection with SARS coronavirus 2, which is the virus that causes COVID-19. The point of care test is available in testing site in less than 1 hour, and the laboratory analysis is 1 to 2 days after receiving by lab. For people those are positive in the viral test of COVID-19, they need to take protective steps. Stay at home and get medical care. For those who are negative in the viral test of COVID-19, they are probably not infected, but it does not mean that they are not sick, as it may be in early stage and will be positive later or exposed later to develop illness, they may still spread the virus. The second test is the antibody test of COVID-19. In the antibody test may not find antibodies in someone with current COVID-19 infection. They also not be used to diagnose COVID-19 infection. For those who are positive in the antibody test, they may have antibodies from infection of COVID-19 or possibly infection of same family of virus called coronavirus. If they have no symptom, they may no active infection or have asymptomatic infection. If they have symptoms, they need to take viral test. For the people who are negative in the antibody test, they may not have COVID-19 before, but they could still have current infection as antibody take 1 to 3 weeks or even longer time to develop. If they develop symptoms after antibody test, they also need to take viral test. The last is the prevention and control of COVID-19. To prevent and control the spread of COVID-19, first, you need to clean your hands often, wear a mask, practice social distancing, disinfect at regular intervals, stay at home if you feel unwell, avoid touching your eyes, nose or mouth, cover your nose and mouth with bent elbow when you cough or sneeze. If you have fever, cough, and difficulty in breathing, seek medical attention, call in advance. Follow direction of your local health authority. So that's all about the presentation. Thank you.